Are you worried about wisdom tooth extraction? Wondering if you really need it, how painful it might be, or what complications could arise? Want to know how to find the best surgeon, what to expect during recovery, and how to manage post-op swelling or numbness? In our latest video, we break down everything you need to know, from finding the right dentist to essential aftercare tips so you can face your extraction with confidence. Don't miss out. Watch now to get all your questions answered. Wisdom tooth extraction is often a complex and time-consuming procedure that can present various challenges. The complexity arises from the positioning of the wisdom teeth, which are located at the back of the mouth and can be partially or fully impacted, making their removal more difficult. Additionally, there are potential post-operative complications such as infection, swelling, and prolonged pain. Understanding these factors is crucial for preparing adequately and ensuring a smoother recovery process. This video aims to shed light on why wisdom tooth extractions can become complicated and offers practical advice on how to minimize these issues. It highlights the importance of proper pre-extraction preparation, including assessing the need for removal, consulting with your dentist, and following specific instructions to reduce discomfort and expedite healing. The position of a wisdom tooth is a significant factor that contributes to the difficulty of its extraction. As the last teeth in the dental arch, wisdom teeth are located near the back of the mouth, close to the throat. This location presents a unique challenge because the surgeon has limited space to maneuver the necessary instruments. Unlike teeth in the front or middle of the mouth, which are more accessible, wisdom teeth are situated in a cramped area where no instrument can fully reach with ease. As a result, extracting a wisdom tooth in this position requires a high level of expertise and technique. The oral surgeon must carefully navigate the tight space, ensuring that the procedure is performed safely without causing unnecessary damage to surrounding tissues. Additionally, the restricted space in the back of the mouth not only complicates access, but also hinders the removal of the tooth from its socket into the oral cavity. Once the wisdom tooth is loosened, the limited room available makes it challenging to extract the tooth entirely. The surgeon must employ precise methods to gently ease the tooth out without causing further complications. This combination of restricted access and limited space requires the oral surgeon to be exceptionally skilled, making the extraction of a wisdom tooth a procedure that demands both patience and advanced surgical techniques. When preparing for a wisdom tooth extraction, the first crucial factor to consider is the tooth's position relative to the other teeth and the jawbone. Wisdom teeth may erupt fully, partially, or remain impacted beneath the gum line. Fully erupted wisdom teeth generally pose fewer complications and can be removed more easily compared to partially erupted ones. Partially erupted or unerupted wisdom teeth often require a more invasive procedure, which might involve cutting into the bone to access and remove the tooth. This can lead to increased trauma, resulting in significant swelling and discomfort post-operation. Understanding the positioning of your wisdom teeth helps your dentist determine the most appropriate extraction method and anticipate potential challenges. If the wisdom tooth is partially erupted or impacted, the procedure might be more involved and could lead to more pronounced post-operative effects. Preparing for these possibilities and discussing them with your dental professional can help you manage expectations and take proactive steps to reduce discomfort and promote a smoother recovery. When considering the extraction of a wisdom tooth, one of the critical factors to evaluate is the angulation of the partially or fully impacted tooth. Unlike fully erupted teeth, impacted teeth can present a variety of challenges depending on their positioning within the jaw. The type of angulation plays a significant role in determining the complexity of the extraction process. Among the different types of impactions, the mesioangular impaction is the most common. In this scenario, the wisdom tooth is tilted towards the front of the mouth. Mesioangular impactions are typically the easiest to remove, as the angulation allows for a relatively straightforward extraction, often requiring less time and effort. In contrast, a vertical impaction occurs when the wisdom tooth is positioned upright but remains partially or fully below the gum line. While this type of impaction is generally more challenging than a mesioangular impaction, it is still manageable. The primary difficulty lies in the limited space at the back of the mouth, which can complicate access to the impacted tooth. Despite these challenges, vertical impactions are less complicated than other forms of impaction, but they still require careful consideration by the oral surgeon. The most challenging of all is the distoangular impaction, where the wisdom tooth is tilted backward, away from the front of the mouth. This type of impaction is the most difficult to extract due to the awkward positioning of the tooth. The backward tilt makes it harder for the surgeon to access and remove the tooth, often leading to a more complex and time-consuming procedure. Distoangular impactions require a high level of skill and precision to ensure that the extraction is performed safely and effectively. Another important factor to consider during wisdom tooth extraction is dilaceration. Dilaceration refers to the abnormal bending or curvature of the tooth's roots. Since wisdom teeth are the last to erupt and are often located in an area with limited space, they are more prone to undergoing morphological changes to fit within the available room. This restricted space can cause the roots of the wisdom tooth to bend or curve in an unfavorable manner, a condition known as dilaceration. When this happens, the root can become hooked around the bone, making the extraction process particularly challenging. In cases where dilaceration is present, the curved root acts like a hook, gripping the surrounding bone tightly. This abnormal root structure complicates the extraction, as the tooth cannot be easily pulled out in one piece. To manage this situation, the oral surgeon may need to break the tooth into smaller pieces and remove them individually. This approach allows the surgeon to carefully extract the tooth without causing damage to the surrounding bone and tissues. Although this method is more complex and time-consuming, it is often the most effective way to ensure a safe and successful extraction when dealing with dilacerated wisdom teeth. One of the most crucial considerations, especially for the lower wisdom teeth, is their position relative to the nerve canal. In the mandible, a prominent structure known as the mandibular canal runs close to the roots of the wisdom teeth. The position of this canal is vital because it carries the inferior alveolar nerve, which provides sensation to the lower jaw, including the teeth, gums, and lower lip. In some instances, the canal runs in very close proximity to the roots of the wisdom tooth, and in rare cases, the roots might even impinge upon the canal. This close relationship between the tooth roots and the nerve canal makes the extraction process more delicate and requires careful planning and execution by the surgeon. If the roots of the wisdom tooth are in close contact with or impinge on the mandibular canal, there is a risk of temporary numbness following the extraction. This numbness occurs because the nerve may be irritated or slightly damaged during the procedure. Patients might experience this numbness along the lower jaw on the side where the tooth was extracted. The sensation typically affects the gums, teeth, lower lip, and sometimes the chin. While this numbness is usually temporary, it can last from a few days to several weeks before gradually resolving as the nerve heals. Understanding this risk and discussing it with the surgeon is essential for anyone undergoing lower wisdom tooth extraction. Another important aspect to consider after wisdom tooth extraction is post-operative swelling. When the bone is cut or manipulated during the extraction of a wisdom tooth, it's common for patients to experience swelling around the affected area. This is a typical post-operative complication, particularly in cases of complex extractions where more extensive surgical procedures are required. It's essential to be prepared for this swelling, but rest assured that it is usually temporary and will subside within a few days. To minimize discomfort and reduce the swelling, following strict postoperative care instructions is crucial. Additionally, avoiding sleeping on the side of the extraction can help prevent exacerbating the swelling and any associated discomfort. It's also worth noting that individuals with more cheek fat may experience a larger degree of swelling due to air becoming trapped within the tissues. This is a natural response and can make the swelling appear more pronounced. However, with proper care, including the use of prescribed medications, cold compresses, and following your dentist's advice, the swelling should gradually decrease and become less bothersome. Understanding and anticipating these post-operative effects can help you manage your recovery more comfortably and ensure a smoother healing process. The first step in your treatment journey is to find an experienced surgeon who specializes in wisdom tooth extraction. Start by conducting a Google search for dentists or oral surgeons in your area, paying close attention to their reviews and ratings. Take the time to read through patient experiences to find a surgeon who is well suited to your needs. Once you've identified a potential surgeon, make an appointment for a comprehensive oral checkup. During this visit, the surgeon will assess your condition and determine whether it's necessary to extract the wisdom tooth immediately or if it can be monitored for a while longer. In some instances, your family dentist may ask an oral surgeon to visit his dental office for the extraction. If so, it could be more convenient and comfortable to have the procedure done at the dental office, where you are already familiar with the staff and surroundings. Being in a familiar environment can help reduce anxiety and make the overall experience more pleasant. Whether you choose a new surgeon or one recommended by your dentist, ensuring you feel comfortable and confident in your choice is essential for a smooth and successful extraction process. Before undergoing wisdom tooth extraction, the first practical step is to take a radiograph, commonly known as an X-ray. This imaging technique is crucial for providing a clear view of the impacted tooth's position within the jaw. The radiograph allows the dentist or oral surgeon to assess the exact location of the tooth, its angulation, and its proximity to other vital structures like the mandibular canal. By examining this detailed image, the surgeon can identify any potential challenges, such as whether the tooth is impacted, the type of impaction, and the presence of dilaceration, where the roots of the tooth might be bent or curved. In addition to revealing the tooth's position, the radiograph is also essential for detecting any abnormal root formations, like dilaceration, that could complicate the extraction process. If the roots are bent or hooked around the bone, the surgeon can plan the extraction with greater precision, potentially deciding to break the tooth into smaller pieces for easier removal. By taking this initial step of obtaining a radiograph, you can ensure that the oral surgeon has all the necessary information to perform a safe and effective extraction, minimizing risks and improving the overall outcome of the procedure. Obtaining a 3D radiograph, such as a cone beam computed tomography (CBCT) scan, can greatly enhance your surgeon's ability to plan your wisdom tooth extraction with precision. Unlike traditional X-rays, a 3D CBCT provides a comprehensive, three-dimensional view of the tooth and surrounding structures. This advanced imaging technique allows the surgeon to assess the exact position of the tooth, the morphology of the roots, and the placement of the crown in multiple dimensions. The sophisticated viewing software associated with CBCT scans enables a detailed evaluation of the relationship between the tooth and the mandibular canal, ensuring that every aspect of the extraction is thoroughly planned. In addition to providing a clearer view of the tooth's position, 3D X-rays like CBCT can detect any impingement of the tooth on the mandibular canal. This information is vital for predicting the likelihood of numbness after the extraction, especially if the roots are close to or impinge upon the nerve. By using a CBCT scan, the surgeon can anticipate potential complications and develop a strategy to minimize risks, ultimately leading to a safer and more successful procedure. This advanced imaging tool is invaluable in ensuring that your wisdom tooth extraction is handled with the highest level of care and precision. Once your wisdom tooth is extracted, it's crucial to listen to your dentist carefully and follow all the post-operative instructions precisely. These guidelines are designed to ensure a smooth recovery and minimize any potential complications. If you need further clarification, you can also refer to our instructional video, which provides a detailed explanation of the aftercare steps. Remember, while complications can sometimes occur, they are typically manageable with your dentist's help. It's important not to panic if you experience any issues. Instead, reach out to your dentist for guidance. With proper care and attention, you can navigate the recovery process smoothly. Wishing you a safe and successful dental treatment.